when I was sort of looking at this and how we manage claims, a lot of what I'm going to talk about is how we're starting to manage claims because of the changes and what we're seeing taking place at the moment. And really a lot of the psychological injury claims we've dealt with in the last 12 months have gone in pathways that we didn't expect and have been accepted when we didn't expect them to be accepted. So when we look at return to work, one of the major things we need to look at are what's the person's symptoms, diagnosis, what are they doing for treatment, which often we find is not much, what caused the injury, and we'll focus on this a bit later on. Are there any grievances in the workplace that have been unresolved, and what's going on with performance management? Because we find performance management may have led to the claim and may still be in place or want to be in place after the claim, and it's been clouded over and across the psychological injury. One thing that I see a lot is doctors and psychologists putting people off work when they have a psychological injury. Now, as an ex-psychologist, I'll tell you that the last thing we want to do is actually put someone off work. And if we look at the two major causes, so depression and anxiety, what we see is as an actual symptom is social withdrawal. So these are people who have a condition that part of the symptoms is them not going to work. And I read a great little statement in a handbook the other day that depression feeds on withdrawal and inactivity. So if we're putting someone at home, they're actually going to get worse, not better, if they've got depression and anxiety, which make up the bulk of the claims that we're dealing with. Okay? One of the most important things here is what happens when we're sitting at home. So generally we're home alone, we're miserable, we're upset, and we're fixating on something that's going on in our lives that's put us off work. Everyone here would have heard of what we call the depressive spiral. You know, we're depressed already, we start thinking about everything bad in our lives, and it actually makes us worse and worse and worse. So if the person is at work, even if they're not doing their full job, at least their mind's taken up and there's less time for them to actually be, sitting around thinking about how bad life is. On top of that, there's social interaction. So we're actually starting for people to see that, hey, being at work's not a bad thing. I still get to go and have a bite to eat with Andrew at lunchtime and spend a bit of time with my friends. I get to see some clients that I like. Because the other thing when we look at depression and anxiety is often people don't feel any joy out of life. And they're definitely not going to feel any joy out of life sitting at home watching Ellen, which is generally what happens. So if we look at performance management, so a lot of claims that I see are a result of performance management, either being done badly or of other factors of it. But what I've seen recently is we have thought, we've dealt with someone like Adam or someone else at one of the insurers, and we thought we've had Section 40 tied up in a nice little bow of reasonable management actions. And then we get the factuals. And we find out, as one recently, that there'd been a stand-up argument that could have been heard at the other side of the office that had not been told to us prior to starting this process. Or we learn about something that happened 6 months ago that was never resolved. So factors that are not given to us up front, which are going to mean that the claim gets up. Okay, so if we're not getting all the information, and this goes back to a couple of speakers talked about your supervisors and managers, and they are your biggest risk in your business when it comes to psychological injury. Because if we're not training them, if we're not getting them to address their workers correctly and follow the appropriate processes, and more importantly, when they mess up, if they're not coming to us and saying, hey, I've done something wrong. Because we can always try and fix things if we know about them. But if it's a surprise that hits us during the liability process, we can't do anything about it. I also see a lot where there is a claim and we're getting the performance management issues mingled in with the claim. And what I used to do a long time ago, because I am old now, when I used to work with Gavin there 20 years ago at Resolutions, I'd sit in as the rehab provider and say to people, okay, hold on, what's performance management and what's to do with the claim? And I'd literally write this up on a whiteboard with the line down the middle so we could actually be very clear what was to be dealt with as an employment issue and what was to be dealt with as a claims issue. Because I find that gets very muddied. And you'll often find that people will rely on their claim to avoid having to deal with performance management. And as much as, I was a psychologist and I can be touchy-feely when I need to be, what I look at is if someone is not performing at work, a workers' compensation claim should not impact on that. Whether it's a broken ankle or a psychological injury, people still need to be managed. And if we actually go and look at the conditions that people have, and I'll talk about this a bit in a minute, it's actually adverse for us not to manage these. So what doesn't help when we're looking at getting someone back to work and we're dealing with a psychological injury? Treating it differently to a physical claim. And I see it from the insurer's side and I see it from the employer's side. And it goes back to what Jay spoke about earlier. People are scared to deal with it. All right? So what we talk about a lot as psychologists is we don't want to enable someone's behaviours. So you look at the symptoms that people are having with psychological injuries. If we just say, well, we're not going to do anything about that because this person's stressed or they're depressed or they're anxious, that person is generally going to push back further and further, and we're going, we're not going to deal with that either, we're not going to deal with that, and the person actually gets worse. The same as we talked about a person being off work, if we're not setting them expectations and we're not holding them accountable to the same things we would in the workplace as everyone else, why would they ever perform? Why would they ever actually start to get better if there are no consequences? The nth degree is how family members of people with alcoholism are taught to deal with them. Often what happens is the family member will clean them up, get them showered, make sure they're okay, get them off to work, clean up all the bottles, all those sort of things. But the person then is never learning and there's never any consequences. So going down that pathway of saying to someone, well, look, you know what, understand you're depressed, but you've actually been 2 hours late for work for the last month. Yes, we'll be a supportive employer and assist you with your depression, but if we take the hard line approach, is this person actually fit to perform the inherent crimes of the role? And that is a question that we need to ask ourselves along the way. Just as if someone had a back injury and could no longer lift, we wouldn't actually bring them back into the workplace and continue to allow them to lift and actually make that injury worse. Okay. The biggest part I look at is not understanding what we're liable for. And this is something that I've seen a lot lately, and I've got a few slides of that in a minute. What do we want to know? We want to know the triggers. So generally it is, can't work with this person, can't handle money if there was an armed hold-up, some of those sort of things. But further than that, we need to understand the incapacity. We need to get clear restrictions. And I'll go back to this again, we need to be very transparent about what we were liable for. Why was the claim accepted? So use an example from before. We had performance management tied up in a nice little bow. One incident led to the claim being accepted. Do we understand that? Because I'll guarantee in the situation I'm talking about, the worker doesn't. The worker believes that it was accepted for the issues that relate to performance management. So as we're trying to address a return to work, but also address performance management because the issues haven't stopped, the doctor is writing the worker off because the worker's upset about being performance managed. Because it was never made clear to the worker at the start that this was all reasonable management action. The reason your claim has been accepted is because of this one incident, which has nothing to do with reasonable management action. Okay? So being very clear on that gives us a bit of a pathway to actually have an open discussion and be transparent about it. Excuse me. If we're not clarifying it, how can we change the worker's misconception? And I'll actually throw a question at Adam when he gets up later on. I would query whether any agent out there is actually sitting down with the claims people after a liability decision and saying, hey guys, just need to make you very clear, this is why the claim was accepted for psychological injury. So that when the worker raises that with the case manager will say, look, I understand what you're saying, but these are not the reasons your claim was accepted. Again, transparency. Psychological injury, we look about this, people will go home and they'll ruminate and they will make up what is happening in their heads without evidence. So if we give them information, we give them evidence that they can think about, it's likely to try and short circuit that as much as possible. Okay. When we talk about psychological injury, what are the barriers? What are the restrictions? What is it that's actually holding people back? So again, we hear, can't work with this person. Well, is that a restriction? Because, okay, that's great. So you're saying, I'm really upset, I'm really depressed to the point where I've now got a claim, but if I don't have to work with Andrew, I'm actually better overnight. I'm instantly healed. It's not really a restriction. This is the problem we start to get. So if we go back and look at the signs and symptoms I had up before, what we generally see with people with depression, anxiety and other psychological injuries is they talk about having problems with memory. Like, my memory is not as good as it was. They talk about poor reaction time. I cannot actually think quickly enough to do these things. They talk about problems with concentration. I actually cannot concentrate enough to get the job done. And they talk about an inability to problem solve, to actually know where to start, how to identify the problem and put a process in place to overcome it. So if we're just focusing on can't work with this person, we're not actually addressing the real barriers to this person coming to the workplace. So think for yourself, if you thought your memory was poor, if you didn't think you could react fast enough, so you're a truck driver, you're a forklift driver, you're an air traffic controller, if you didn't think you could concentrate and you didn't think you could solve problems, would you be confident to come back into the workplace? Right? So we have to take that into consideration and try and work with the person. It's an open discussion. What is it that is actually stopping you? What are your concerns? You can ask, how's your memory? How's your concentration? How's your problem solving? What medication are they on? Because if they're on strong antidepressants or anti-anxiety medication, what you'll find is their reaction time will be even further impaired. Okay? So we wouldn't let someone who came to work and said, look, I'm on really strong painkillers or I'm on antidepressants, not work-related, would we really let them just jump behind the wheel of a truck without investigating that further? Yet we're expecting people who have a psychological injury to do the same without checking those factors. Right? So what we need to do is gather information. What are those things in the workplace that are going to trigger me? So we can take those out. We can work around that just like we would take out heavy lifting and those sort of things. We then look at what are the restrictions. What is the actual incapacity? Okay, they're having problems with their memory. So we're not going to give them tasks that involve them having to remember complex things. Right? They have a problem concentrating. Okay, in that case, let's not put them near spinning blades. Let's not put them in a vehicle. Okay? I'm having trouble problem solving. Okay, well, let's give them easy tasks, things that aren't complex. All right? Now, if we've got that, we can go to the workplace and find suitable duties in around that, and we can have a more educated discussion with the treaters around why these duties are suitable. Furthermore, we can go back to where I started and actually say to the doctor, do you realise that it is contraindicative from a treatment perspective to put this person off work? And that actually, as much as a person doesn't want to come back to work, it'll be one of the first steps of their recovery. Because what do we see generally when we look at a psych claim? How many people think a person says, I'm stressed, I'm depressed, and I've been off for a month, are going to come back to work? How many have gotten someone back to work who's been off with anxiety, depression for 6 months? The statistics say that's very unlikely. Okay?